You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. With us, we have Dr. David Bowen. Dr. Bowen, welcome to the program.
Thank you. It's great to be here.
So first off, and I have a list of questions here I want to ask you, but who's the typical dental implant patient that you see?
You know, we don't have a typical patient, but they fall into two different groups.
Okay.
The first group is someone who's got a really ill-fitting denture, a loose denture. They've had their teeth extracted several years ago. They were told they couldn't get dental implants. And so they're using a denture. They've been using it for a little while, and it's loose, and food gets caught underneath it. And for those patients, we can give them an upper and lower set of teeth that are not ill-fitting, that are solid on the day of the procedure. They come in with a loose-fitting denture. On that day, procedure day, they come out with a full fixed set of teeth.
So when you say, I mean, they could literally walk in the day of the procedure with no upper and lower teeth and walk out with upper and lower teeth that don't come out.
Absolutely. Yep. With implants, the modern advances with dental implants, we can absolutely achieve that.
Okay. Now, what's the second group of patients you were talking about?
The second group of patients are patients who have a bad breath. They've got gum infections. They've got loose teeth. They've had fillings and crowns and things have broken off. They've felt like they're heading towards a denture for a long time. And those patients as well, we can get in there, we can clean up their gums, we can relieve them of that infection, and then we can provide them with a set of teeth that stays in place on the day of that procedure as well.
So when we say at the top of the program, no more dentures, do you think this is like the future of dentistry possibly, whether it's 50 years or 20 years? The dentures as we know them today won't exist. They'll all be attached to something?
Absolutely.
What do you think of that?
Absolutely. I completely agree that within the next few years, we will see a lot less of the loose, ill-fitting dentures, a lot less videos of the people blowing out their birthday candles and seeing a denture fly out on the cake.
Okay.
We'll see a lot less of that because dental implants are such a wonderful addition to that procedure.
How old? Like, how old could you be to get this done? Like, what's the oldest patient you've heard of even doing this?
I mean, the oldest patient I've heard of is 102 years old.
Okay.
I myself, I've treated patients in their late 90s.
Why would a 90-year-old want to get new teeth with implants?
So, I get that question a lot, actually. And the answer that I always get is it's not about your age. It's about the quality of life that you want to have. Do you want to go out with your kids and enjoy a nice juicy steak, or enjoy eating fresh fruit, or taking a bite of an apple without having to worry about your teeth falling out? Or like I talked about earlier, blowing out your birthday candles and having your denture fall out on your birthday cake. I mean, that's embarrassing. So especially when you're older, it's a good idea to be doing this, because what are you going to be doing? You're going to be interacting with your kids, with your family,
you're not working
with your
anymore.
friends. Exactly. You're eating good meals. You're going out and eating good meals with your friends. And so absolutely, I want people to focus on the quality of life that they can have after this procedure.
So if 90-year-olds, 100-year-olds are doing this, so when you hear you get a person 75 years old and they go, "Doc, I think I'm too old." Mm-hmm. So that's not even close to too old to do this.
Oh no, not at all.
Is that right?
Not at all.
Now, statistically, are they more likely to fall out, these implants, if somebody's older?
No. All of that work is done on the front side. So we're looking at the quality of bone. We're looking at, we give you very specific instructions on how to take care of this, because we want this to last for as long as possible.
Now, you're in Bozeman, right?
Yes, sir. Yeah.
Affluent area. Are there people that have bad teeth there?
Oh my goodness, yeah.
Really?
Yeah, absolutely. I mean, if you look at the statistics, the national statistics, there are, I think, 31 million people either have an upper or lower denture. On top of that, there's 60 million people they're missing 9 or more teeth. I think that you could fill a lot of the Bobcat Stadium up there in Bozeman with people who are eligible for dental implants or for implant-supported denture. And so there's a lot of people out there that could benefit from this.
Now, do you draw from, in Montana from a lot of people an hour, 2 hours away?
Absolutely, yeah. I mean, Montana, we're used to traveling up there because it's such broad territory. It's big sky country. So we serve a lot of the different counties surrounding the Gallatin County.
Okay, now you have been around dentists since you were a little kid. Yeah. Your mother's a dentist. I think your brother's a dentist. Mm-hmm. I think you have uncles or cousins that are dentists. Everybody was a dentist.
Yep.
But you didn't want to be a dentist at the beginning. You said.
Yeah. No, I did everything in my power not to become a dentist. I took business administration through Walla Walla University. I decided I wanted to do marketing. I went into radio advertising for a little bit, and and really didn't like it.
Okay.
And so I was whining to my brother one day about how my choices had led me to that decision. And he said, well, you know, David, why don't you just come and sit down in my office and just come watch? And so I went.
And your brother's a dentist.
My brother's a
Yeah,
dentist,
okay.
yeah. So I went and sat down and watched him just interact with patients. And to me, that was the coolest part. That's what sucked me in.
Okay.
And so from
Because
there.
you love it. I mean, you told me that on the phone. You love it.
It's a lot of fun. For me, the most fun about this is sitting down and just connecting with someone. You know, hearing about their life story, what brought them here, why they're here in the office, what can I do to make it so that, you know, this is their smile now and we want to move it to here. How can we do that? And then figuring out the pathway to that. To me, that's so much fun.
Now, is dental implant dentistry like the happiest group of patients?
Oftentimes,
Of all dental patients?
Oftentimes, yes, because they're going from either that bad breath, that gum infection, those loose teeth, and you know, oftentimes you'll see people when they laugh or they smile, they cover their mouth because they're embarrassed. And so you are taking a patient from that into they're confident, they're happy about their smile. They can go out, they can eat whatever they want. They can sit down and they can look at the menu and say, oh yes, I do want the steak, or I want nachos, or whatever it is, and not have to worry about food getting caught under their denture, or their dentures coming out, or the embarrassment of the teeth, the bad breath.
What do they like more? The way it look when it's all done, right? What do they, and we're talking about people that had really bad teeth and gums or currently wearing denture. Now they have new upper and lower teeth supported by implants. What do they like most? The way it looks, or do they like what they could eat?
Yeah, you know, I have a lot of patients who come in and they say, I don't care about what it looks like. I don't care about that. I want to just eat good food.
Okay.
And over the course of our treatment, you watch them transform a little bit and they become more confident. They start to smile a little bit more.
Okay.
They start to joke and interact with our team a little bit more because they're feeling that level of confidence that comes with their smile being that much better.
Do you ever read people wrong? Like you think, you know, this guy's one way, very serious. Then you give them the new teeth, the new smile, and then they act differently. I mean, is that traumatic? I think you told me that.
Absolutely, yeah. I had a patient recently, actually, that he was a young guy, not much older than myself, and you could tell when he walked in, he was just kind of defeated. He had just lost his job, and he had lost some front teeth, and he was just ready to make a change in life. He had the bad breath that comes with the gum infection, and he was really concerned about not being able to eat the foods that he wanted to, and so he was one of those people that was very concerned about function. That's what he wanted. And so over the course of time, we cleaned up his gums, we cleaned up that infection, and you could watch it almost like the clock turned back a little bit. He started to be a lot more excited about coming to the dental office. He was interacting with younger people. He got a job. His life is definitely benefited for the better.
Now, you told me you have patients who will actually tell you, doctor, you've changed my life. They say that?
Yeah. Well, you know, and the way that I look at it is it's not me changing their life. I'm not really doing anything to change their life. It's them becoming more confident in the smile that they already have. And so they are, with that level of confidence, they're going out and they're smiling to their neighbors, and those interactions become better. They're smiling with their friends, and their friends are saying, hey, what happened to you? And they're realizing that they're feeling a lot more confident about their smile and their appearance. You know, someone told me once that when you are self-conscious about something about yourself, it holds you back. And so in this, if you're self-conscious about the way that your teeth, your breath smells, the way that your teeth look, and you don't want to smile, that's holding you back from those social interactions that you're having on a day-to-day basis. So taking that away, you have people that are a lot more excited about smiling and interacting with you or with the patient and so forth. The other thing that I like to say is they changed their own life. They were the ones that made the step, that took the step to call our office. You know, no one really wants to come into the dental office.
No, they don't. Do you ever hear that?
Oh my goodness, I hear it all day long.
Like, what do they say? Like, no offense?
Yeah,
I just
no
don't like the
offense,
dentist?
but I don't like being here. And we get it. We hear it all day long. But our team is so well trained. We work to make everyone feel really comfortable and just to feel like it's a safe environment for people to come in and talk about what they want to do with their teeth. So just making that phone call it's the first step. And that allows us the opportunity to sit down and talk with them, start that relationship with them.
Now, I have a question about gums. I mean, can you still get dental implants if you had or have gum disease? I mean, you had bad gums, that's why you lost your teeth. Can they
Yeah.
do dental implants?
Yeah, that's usually why they come in, is they've got bad breath.
Okay.
They have an infection, or they've been told that they're going to lose all their teeth and they have an infection in their mouth.
Okay.
And so absolutely, we can get in there and we start by looking at everything. So we look at your existing teeth. Are there teeth that we can save? And if so, fantastic. If not, then that's when we'll have the discussion about implants. But we can get in there, we can clear your body of that infection, we can clean out around those teeth to hopefully better set up that foundation. It's like building a house.
Okay.
If you have a good foundation, then you can start putting the walls up and you can start putting the finer details on. We want to build that foundation. We want to make sure that you've got solid teeth in solid bone. And if we can't get that, then we'll place implants.
Okay. So we talked earlier about Bozeman. There's people wearing dentures in the state. So there might be like 100,000 that are wearing a denture? Like an upper lower denture?
I would bet there's far more than 100,000 people.
Is that right? Well, why aren't they all doing it then?
You know,
I mean, if they're so good as you say, why aren't they doing it? What's your take?
There's 4 or 5 reasons why people don't often do this.
Okay.
You know, the first one is they've been in a denture for 10 plus years. You know, the last time they were in the dental office was 10 years ago when they had their teeth extracted. Not a whole lot of people have gone beyond that and said, hey, what's next? Can we do anything else with this denture? So a lot of people have fallen out of the practice of coming into the dental office.
So they don't know their options because they don't
know their
go to
options.
the
Yeah,
office.
exactly. The second one, you know, we often see people say, well, I'm too old, and we kind of talked about that. We've got a vast array of people coming in. People who are in their hundreds getting the same procedure done, or people in their 70s, 80s, realizing that they wanted to make a change, a positive change in their life, or there's something that they've always been self-conscious about, they're ready to be done with, and they want to move on. So the other one that we often hear is that I don't have enough bone.
Yeah, but isn't it true? I mean, if you have been wearing a denture for, let's say, 10 years or 20 years, you can't do this, you don't have enough bone.
Well, that's not totally true.
Okay.
There are different advances in implant dentistry where we can place implants in places where we wouldn't be able to 10, 15 years ago. And so if they're healthy enough to walk into our office, there's usually something that we can do to help.
Okay, now what about people that are in their 60s, 70s, 80s, really bad teeth and gums, or they're wearing a denture, but they're on 4 or 5 medications? I guess statistically over 70 are on 4 medications.
Yeah.
Can you be on things like an osteoporosis medication or a diabetes medication and get this done?
You know, that's a really close relationship that we have with the medical doctors in our community. And it's my goal that any procedure that we do doesn't interfere with the treatment that they're giving. So yes, you can be on many different medications and still get this procedure done. We still work very closely with the patient's physician. So we know that any therapy that we're providing isn't going to be in contrast or hurting anything that the doctor is already providing.
Now, with these people that had this gum infection, right? It's like, I guess like any infection, there's an immune response. It kind of robs you of energy. I don't know if that's true in this case. But when you clear up this infection, give them new teeth, do they ever report that they have more energy or feel better?
Yeah. So, I mean, and this also goes back to the smile. In fact, I read something earlier that talked about just the simple act of smiling can improve your immunity. It improves your confidence in that. But absolutely, clearing up the infection, there is an underlying infection that's in your gums. There's been a lot of studies that talked about inflammation, persistent inflammation in the body, and how that's not a good thing. By clearing that up, we're actually relieving your body of that inflammation and that infection. And people will oftentimes have a lot more energy. They'll feel younger.
So they are healthier.
They are healthier individuals.
When you get rid of that infection.
Absolutely.
Now the infection, this bad gum thing, this gum disease, it kind of lives on the tooth. So when you extract the tooth, they have nothing. They leave.
Yeah, so the
These
tooth
bad
is the access down into the gums. And so it's not just the tooth, but there's bacteria in the gums.
Okay.
So if we can save the tooth, we'll get in there, we'll clean around the tooth, and the tissue, you'll be able to watch the tissue actually shrink up to the tooth, kind of sealing it all off again.
Now, correct me if I'm wrong here. In Montana, and I guess throughout the U.S., dental implants are done at 2 different offices. You go to one place where they do the surgery, and you go to another place where they put the teeth on top. At your office, you do both parts.
Yes.
Is that why you do it so quickly?
Yes. So we try to get everything done under one roof. I don't like the idea of having to bounce around to different offices, doing one thing here, one thing there. That adds a lot of time, adds a lot of expense into the whole process. So it's my goal to get everything done under one roof. The implant goes in the gums, in the bone, in my office, and usually it's restored with a tooth or with a denture in my office as well.
Now, you say people hold on to their bad teeth for too long.
Absolutely.
What do you mean?
So a lot of these people have been dealing with teeth that they don't like. I mean, some people have been dealing with teeth they don't like for their entire life. But oftentimes it's 20, 30 years of gum infection or bad breath that they've lost out on. You know, you put that in perspective, someone who's in their 50s, they've been dealing with a denture for the last 20 years, from their 30s all the way to their 50s. You know, they've been compromising the way that they can eat. They haven't been eating good foods. They haven't been eating the foods that they want to. They all live with that embarrassment of the bad breath that comes along, or the embarrassment of a denture coming out, or having to take a denture out at nighttime. I mean, a lot of these people really want, the most common complaint that we get is that they wish they had done this 20 years ago.
Do you think, this is a total hypothetical, but if there's, tens of thousands, probably in the state of Montana, over 100,000 people wearing an upper lower denture, if they all knew how good this was, it's like there's not enough dentists to even help them.
Right.
Is that true?
Yeah. I mean, I'll speak for myself. Knowing how a conventional denture works, that it's loose, it can get food underneath it, knowing how that all works, I would never go into a conventional denture.
Like if there was a try-in, let's say, I know this is impossible, like, hey, this weekend, denture wearers come in, get a fixed set, meaning upper and lower teeth that don't come out, and they got to try it out for the weekend. Nobody would be able to go back?
Oh, I don't think anyone would want to go back.
Is that right?
Yeah, no, I truly feel that once you kind of recapture that feeling of being able to eat the foods that you want, being able to not have to worry about that loose denture falling out, or the denture sores that come along with it, or even sometimes the smells of a denture. You know, I've had some patients too, wives, they've been married for a long time, but they don't want their husband to see them without their teeth. And so they'll wake up before their husband wakes up, they put their teeth in. Just not having to worry about that and being able to live their life normally. I don't think that anybody would want to go back to a conventional.
And so now, once they get their new teeth, is it just like a regular dental visit? You just go in every 6 months or every year and just get them cleaned?
Yeah, we typically see them actually once a year, and we get them cleaned. We make sure there's nothing building up underneath. We make sure that the implants are looking good. And then people who come back in that yearly visit, they're actually excited to come back in.
Really?
Because at this point, they feel healthier. It's they get to come in, we look at their denture and make sure that everything's looking good. And yeah, it's a lot less fear to be in the dental office.
When it's all done, can you eat can you bite let's say raw broccoli or a carrot with your front teeth, or you got to be careful with the front teeth?
No, with these new teeth, you can bite into an apple, you can bite into a sandwich, a crispy piece of bacon, and not have to worry about that back denture popping down.
What about things like popcorn? Can you eat popcorn?
Absolutely, you can eat popcorn.
So almonds, nuts, whatever?
Almonds, nuts, not worried about it. You could eat caramels. I mean, caramels you can't have with a conventional denture.
Can you chew gum?
You can chew gum.
I mean, could you eat beef jerky?
Yeah, absolutely.
So it's really no limitations.
No, your limitations are far less than you would with a conventional denture.
But I mean, in the same way you wouldn't want to eat ice, according to dentists.
No, don't chew ice.
But you could if you wanted to.
Yes, but don't
you
do
don't
it.
want you to do it. Are there things when they get their new teeth? Do they ever call you and say, "Hey, is it okay to eat this or eat that? Am I ready?"
Yeah, I think.
Are they worried at the beginning a little bit?
Absolutely. It's like when you buy a new car and you're going very slowly over every bumps. They want to make sure they're not going to break it because they like the way they look. They like the way the confidence they get from it. But over the course of time, you start to realize, hey, I can use these a little bit more like my natural teeth, like they were prior to having dentures or prior to moving into these fixed new set of teeth.
Okay. Now, you're a dentist, so you probably think the smile is the most important thing in the world. Healthy teeth and gums. How important is it in your view?
I agree with you. I am a dentist, and I do think it's important. But I think we have to look at it from a different perspective, too.
Okay.
There's lots of different surveys out there that talk about the smile being the first thing that most people notice about somebody else. And so even on dating profiles, online dating profiles, the profile pictures that have the most smiles are the ones that are the most popular. They get the most likes.
Okay.
And so it's not just about the health of the individual. It emboldens confidence. People feel more confident when they are happy about their smile. It's like I said earlier, when you don't like something about yourself, it holds you back. So by replacing those teeth, getting a smile that you're confident in, you're no longer holding yourself back.
Okay.
You're interacting with people more. Your social interactions go up. You start to feel a lot of people start to feel that you're more trustworthy, actually.
Really?
It's one of the things I read recently.
Okay.
Is with just a normal smile makes people feel like they trust you more, like you have more authority on different things.
Now do you think, or not do you think, do patients tell you that they feel judged by others because of their bad teeth?
Oh, absolutely. Yes. In fact, I hear that quite a bit. Oftentimes it revolves around the gum infections. The gum infections, the loose teeth, the bad breath that comes along with it.
So you can't brush and floss an infection out?
No. That's when we need to become involved. We need to get in there. We either need to clean it out or we need to take the teeth that are beyond repair. We need to take those out. So, I mean, even the movies, when they want to make someone look bad or they want to make them look homeless, they'll oftentimes remove teeth. And so it's not just the fact that I'm a dentist that makes me think a smile is important.
So there's a stereotype with bad teeth.
There's a stereotype with bad teeth that comes along with it.
And that goes away, that judgment.
And that judgment absolutely goes away.
Like Halloween stores, by the way.
Absolutely.
You could buy the bad teeth.
the Billy Bob teeth in the Halloween stores. You know, and the other story that I've heard is spouses who, because of their bad breath, they don't like kissing their spouse. You know, and by removing that infection, by cleaning up the infection, we're able to give that gift back to them.
Okay. Now, we're talking a lot about dental implants. Mm-hmm. And I remember on the phone, you told me, you said, I want to let them know I'm a general dentist, and I want to let them know that we just don't do implants.
Yeah. Mm-hmm.
So you sometimes have to rebuild. I think you said that some people will diagnose, I need implants, and they don't.
Yeah, absolutely.
Speak to that.
Yeah. So, you know, I look at it a lot like we're building a house. You know, it's the foundation we talked about. If patients come in and they have smelly breath or that gum infection, we need to then rid the body of that infection.
Okay.
So we'll start off with an evaluation, and we look and we make sure we identify the teeth that we can save and the teeth that we can't save. And based on that, we can develop our treatment plan. And so if there are teeth that we can save, we'll clean them up, we clear the infection, we put these patients on a realistic recall program. And so they're coming into our office and we're ridding their body of that infection.
Okay. What about sedation? You're big on sedation.
Yes.
You love it, as a matter
I do.
of fact. Why?
Sedation is a wonderful thing. You know, as we talked about earlier, no one loves coming into the dental office. I mean,
so sedation takes off that?
Sedation helps immensely.
And what type of sedation are you doing?
Yeah, so we do several different types of sedation. We do just oral conscious sedation for people who like the idea of just relaxing with the dental chair, but they don't want to do the full IV route. And that you just give them a tablet the night or the day of, and they come in and the procedure is done with them feeling a little bit sleepier. The other type of sedation, which is the sedation that I love doing, is IV sedation.
So blood pressure's looked at, oxygen, all that stuff.
Your heart rate's looked at.
And is this true too? You could kind of pull them out of it
Yes.
better than that if you're just taking a pill.
Absolutely. The beauty in IV sedation is it's very precise. Precise dosages that we're using.
So patients like it.
So patients like it.
Is it true that they don't remember the procedure?
Remember. Oftentimes they don't even remember coming into the dental office.
But you can talk to them?
Yep. Mm-hmm. So I can talk to them. I still numb them up. I treat them as if they weren't sedated. So I can talk to them. If they need to use the restroom, we can take them to the restroom. They can still interact on a regular basis. They don't remember being there.
So of the two categories, you have two patients, and we have about 2 minutes left, so I'm going to rush you a little bit.
Okay.
But one patient's wearing a denture, another patient, it's been determined all their teeth have to come out, get new teeth supported by implants. What are the steps to getting your new teeth?
Yeah, the step one is just to determine whether or not you're a candidate.
Okay.
So we look at the bone, we look at everything. We can go over finance, and we can go over our different options and see what direction we want to go. Step two is the fun part. Step two is smile design. So we take photographs, we design out your smile. We talk about, this is what you look like as a teenager, or these are the teeth that you wanted from when you were a teenager. We can design that all out, and then step three is surgery date.
You get your new teeth.
Get your new teeth.
Okay. And what's it like? Like when it's all done and they look at the mirror for the first time, what's that like?
It's an awesome feeling to be a part of. Again,
Okay.
it's that person realizing that they can smile again. They don't have to shield their smile.
Are they shocked in a way?
Oh, they're blown away.
Really?
They have bright, white, shiny teeth. They can smile again. They can chew comfortably. A lot of people are just excited about it.
And I guess my final question is that what are the dental implant options when it comes to getting a full arch of teeth that don't come out? Like, what are the options in your practice? Like, how many dental implants is my question?
Yeah, in as little as 4 to 6 implants, we can replace an entire arch of teeth.
Okay.
So we don't need to put an implant in every tooth. We can accomplish that same result with as little as 4 implants in some cases.
What about the upper?
The upper, same thing. It can be 4 to 6 implants as well up there. So the full mouth we could do in as little as 8 implants. Okay. Oftentimes we need a few more, but in as little as 8 implants.
4 on the bottom, 4 at the top.
4 on the bottom, maybe 5, 4 and 5 on the top.
Now for the denture wearer watching this, is the palate, the roof of the mouth covered
with
the
so
systems?
With the fixed teeth, no. The roof of the palate is not covered. You know, when you are wearing a full, complete denture, the roof of your mouth is actually covered. And there are taste buds that are on the roof of your mouth. So imagine going out to eat and not being able to taste your drink very well, or the texture of the food that you're eating. That all changes when you're wearing an upper denture. And so with this fixed system, you don't have to worry about that. You can taste just as well as you would with natural teeth.
So like a glass of wine.
Yes.
You know, they always talk about the palate.
Yes,
So that's going to taste better.
That's going to taste
Or on a
much.
summer day in Montana, a nice cold beer.
Exactly. Yeah, you'll get that taste back, absolutely.
And so we're out of time. So what is your final message? Somebody watching this, they've heard what you have to say, but they're still skeptical or afraid or whatever. What do you say to them?
Say the first step to anything is just make the phone call. Come in, let's sit down, let's talk. I want to figure out where you're at. I want to figure out where you want to go, and I want to figure out a common sense solution for you. So that would be my advice. Just pick up the phone and give us a call.
Now, where do you recommend? Do you recommend they go to the website, make an appointment, or just call your office?
Calling the office is going to be the best. You can do that over the website. We do have that ability, but just calling the front office allows you the most information from the get-go.
Now, do they always see you on the consult?
Absolutely, yes.
So you see every patient?
I see every patient. It'll be either myself or our Dr. Ryan Meeks, our associate in the practice.
Okay, there's one thing we haven't mentioned about you. We know you come from a family of dentists. We know that you studied implant dentistry, but you possibly are the tallest dentist in the world.
Potentially.
You're 6'11".
Yes,
Right?
Yes, I don't have the hard statistics on that, but yeah, I'm 6'11" and hard to miss.
Now, do patients comment on that from time to time?
Not often when they're in the chair. It's when I sit them up and I stand up, and then they go, "Oh my goodness, you're huge!"
Yeah, because you don't look that tall even right now. Yeah. And then when you stand, you look tall.
Yeah.
Do you think it gives you an advantage somehow?
I'm sure there's some advantage that could be taken from it, but when I went and did my dental school interview, the interviewer said, "Now, David, do you know what dentists do?" So yeah, no, I understand. I'm going to be sitting for the rest of my career, but it's helped. It's been a good thing for me for sure.
Okay, good. Well, look, it was a pleasure having you on the program.
Thank you.
And so if somebody wants to make an appointment, they just call your office. They get to see you.
They'll get to see me.
And from the time they get there, how long does it take where you could give them a price and treatment planning and all that stuff?
That first appointment, once we agree on a direction, they'll get a price as to what we're doing.
Okay, good. I want to thank you again for coming on the show. Good stuff.
Thank you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.